Hi, good morning or good afternoon, depending on where you are. My name is Brian Gee, and I will be the moderator for today's session. The session will run approximately 30 minutes and will be presented by Robert. The topic that we'll be discussing today is it's time to upgrade your practice's PA strategy. Now, all listeners will be on mute, so if you have any questions, please use the right-hand side feature in the questions area to list those questions. At the end of today's session, time permitting, we'll go ahead and start answering the Q&As that came in. If we are not able to get to all of the Q&As due to time, we will follow up via email with a question and answer response. And as we are in a virtual format, please note that if we have any technical difficulties, just stay on the webinar and I will update you as the progress, but we don't anticipate any. So without further ado, let's go ahead and welcome Robert.
Okay, thank you for that introduction on there. Again, once again, my name is Robert, part of our sales and implementation team here with IMS. Today, we're going to be going over the EPA, but before we start, I would like to have a brief word from our sponsor, Ashley, with Cover My Meds.
Hi, everyone. I'm Ashley Brannon, and I am an account manager at Cover My Meds. I really appreciate all of you taking the time to hear about electric prior authorization today. Robert, if you'll move to the next slide. So a little bit about us and a little bit of background. So as many people know, there can be many barriers in place that prevent patients from getting the medications that they need. So at Cover My Meds, we recognize the issue to medication access. Our team has worked very hard to tackle the complications of prior authorization since we were founded in 2008. We completely automated this process for providers and their staff. And so how do we do that? You know, what drives us? So we can go to the next slide here. And I always think it's important to start off with our mission. So our mission is to help the patients get the medications they need to live healthy lives. This is the motto that we all work by here at Cover My Meds and that we use in order to enhance the provider experience when it comes to prior authorization. And then at the end of the day, it all points towards our mission of getting the patients the medication that they need. But also the important question is, you know, how do we do this? How do we get everything to work together in this complicated environment of healthcare? So we can move to the next slide here. It really is based on our network. So since 2008, we've been building and building this expansive network. So we have over 750,000 providers that utilize Cover My Meds. So we started out by having an online portal, but we immediately realized the need to integrate directly within EHR since they're a part of the everyday workflow for providers and their staff. So we have, you know, gone out into the EHR market and really, you know, put ourselves in there in terms of integration with electronic prior authorization. We're integrated within 96% of the pharmacies within the US. So this helps us tremendously because not only can we get the providers access to prior authorization, but we're also integrated within the pharmacy side. So we're covering all of the bases. But also a really important area is the payers. So we are connected to 94% of payers that represent prescription volume. So we are electronically connected to all of the large payers and PBMs. So your Humana, Express Scripts, CVS Caremark, you know, just to name a few, but we're also connected to those smaller Medicaids and Medicares. And we do that by having an expansive forms library. So we have over 20,000 different forms available for the providers and the different end users who utilize Cover My Meds. Providing a seamless workflow to electronically submit those PAs. And that's a brief rundown of Cover My Meds and who we work with, but I'm going to pass it back over to Robert so he can talk about the workflow specifically within Medi-Tab.
All right, thank you so much for that introduction, and that's actually a great lead-in from our sponsor for what Cover My Meds does for your electronic prior authorizations within IMS. So I want to thank all of you for joining, and we'll go ahead and get started with the presentation for you today. So when you're talking about authorizations, electronic prior authorizations, we're really referring to the authorizations from the insurances for your prescription drugs, which again is using Cover My Meds and their network to actually submit those authorizations and then transmit that information into IMS for you. So for today's agenda, we're going to cover what is a prior authorization and what are some common issues of having a non-integrated prior authorizations into your workflow, and then with the benefits of having that integrated into the software that you're already using. Little hint, it's way easier if it's integrated. We're going to outline the different types of EPAs that you will see come through into IMS, and then we'll see how do you use it and what screens are applicable within the system for those prior authorizations, and then of course the communication back to the patient through the use of our patient portal and different areas within the system as well too, because again we want to communicate to the patients what they're able to do. So just a brief introduction, and because some of this was kind of covered by our sponsor as well too, and that is, what is the prior authorization? Well, it's the process to determine whether the health insurance company, so the payer, is going to cover that prescribed medication or not. Okay, so that's what we're talking about, prior authorizations. We're not talking about the procedures. In this situation, we're talking about the actual prescriptions themselves. And your current workflow for the authorizations is, again, the patient's going to traditionally take that to the pharmacy. Then the pharmacy is going to decline it because they say they're going to need some type of authorization before they approve it. And then the doctor now has to fill out some form, and the patient's all in this waiting queue of having to determine whether or not they're going to get their pills covered, and they've already had to make 2 or 3 trips to the pharmacy and wait for that to be done, and then hopefully get a message from the pharmacy of when it's done. And traditionally they wind up calling the clinics and thinking it's the clinic's fault that their medication is not there. And that's where the problem lies. Okay, there's that delay and the lack of patient care. Yes, we run businesses and we're doing the clinical thing on there for that, but it's really our patients are at the center of all of this. We wouldn't be in this profession. You guys would not be doing the job that you do if patient care was not number one. So we want to make that through any feature that you're using with IMS, we want to be that to the center. And 40% of these PA requests are actually abandoned because the patient just gets tired of the whole process. So they're not even getting the medications they want. And we know that time is money. So, providers and staff, that's 20 hours per week. And that's just on average. Some clinics are spending more on just PA requests. In some clinics, they have just a staff member that does nothing but prior authorizations. And a lot of times their skills can be utilized in other places than just that. And of course, it's a strain on the pharmacists as well, too. And this costs everybody money. Operation cost for the healthcare system as whole, we're talking billions, tens of billions annually that is lost just in this process that we can clean up and make easier for you. And the solution to that is electronic prior authorizations. If your prior authorizations are getting done electronically, it makes it easier. Companies like Cover My Meds, they make this extremely easy of a process. Their forms are amazing, and their communication skills with these different payers and everything is great. So we want to be able to leverage that and make that work within IMS as well too. So we want real-time information for these prior authorization decisions. We want to know at the time that the information is being prescribed. We want to be able to see that and start the process as soon as possible to delay the waiting for that. And we want real-time decisions, and we want alerts for that. Now, there are 2 types of EPAs that we're going to be working with within IMS, and when you get it electronic on there. There is the prospective and there is the retrospective. The retrospective is the one we don't want. Okay, kind of working from the bottom up, but the retrospective is the way where, again, it creates way too much time. We don't get that until it's rejected by the pharmacy and saying that they need one. We want as much of it as possible to be prospective, which means that when the prescriber is actually prescribing that medication, they're going to be able to see within the system, within IMS, that there is going to be a prior authorization required for this particular medication, and they can start that process immediately. Therefore, somebody is already working on it before the patient even leaves the clinic. So EPA and IMS. It is a partnership between us and CoverMyMeds. CoverMyMeds is the one that is doing the legwork as far as communicating with those payers and letting us know what is covered and what is not covered. On there, they're your main solution for all of this. And as most clinics are familiar with the CoverMyMeds website and the forms that they're using, we're just integrating those directly into the system for you. Now, the EPA solution is based off of the NCPDP information, so it's all through SureScript. It is all HIPAA compliant. It follows all those standards on there, so there is no break in continuity there. And we want it to be built into the actual workflow of the prescription itself. And this is key in what we've done with IMS, and why you want to go with this solution is it wants to be a real-time check of whether or not that PA is required or not at the time of prescription, or at the time of entering in that medication if it's a clinical staff member. And if it is detected at the pharmacy level, we want that information to electronically come into your MyTask screen, so that way you can see that you're getting those retrospective PAs before you're having to wait for the pharmacy to call you. You can see it as soon as it's submitted. We want to be able to track that workflow and then fill out the forms from a quick link within IMS as well too. So let's take a look at that workflow. So when you are prescribing a medication to a patient, in this case here, I have my add prescription screen open on the right-hand side. And if you do notice, when you're doing a prescription, so you will see stuff on here, and a lot of people overlook at what this stuff is, things like the formulary and the payers and things like that, but it is all important information. Utilize what is on your screen for you. We do have the start EPA process here, and it will let you know if an item requires that authorization. Again, we know that we have the payer information, if they have retail coverage or what or not. And if you do start that EPA process, then it can be sent to your prescription screen, and we could start the prior authorization process directly from this area. Okay, very crucial. The same can be done from the prescription window, the same one that if we look at the screenshot at the bottom, this is the one that most of you are used to seeing when you're approving refills and things like that. We can select that, and we also have in the top search area, we have the change prior auth requirements and the request and the start EPA process directly on there as well too. Now, when you are putting in the forms to be filled in IMS, it is the CoverMyMeds portal that's being used. So when you do start that process on there and you do launch the form, it does pull up the same form that you are used to seeing on CoverMyMeds. That's a great opportunity for you, because you're able to have that familiarization on the workflow that you're already using. Now, what's very beneficial on that is because all the information is being initiated from IMS and from the system, then it's going to be able to push all of the information that you already have into that portal for you. So things like the patient's name, things like the insurance information, address, all of that demographic stuff that eats up time having to input it or copy and paste or locate where it's at or grab it from some type of face sheet. It's all right there for you. It pushes the information in, and all you're doing is maybe checking one or two boxes and you're on your way. Now, if it's coming in as a retrospective, then what we've done for you is within your MyTask screen, those that are authorized for EPAs will have at the very bottom on their left panel, they will have an extra indicator. We'll have the CoverMyMeds icon on there for the EPAs, and they will be able to see if there's any retrospective EPAs that are coming through. They can also check the status of those EPAs and see what's on there directly from their chart view. There will be an extra tab once you've turned on this feature. There will be an extra tab that is available to you in the chart view to track their EPAs and the status of those. So when those patients are calling in and finding out what the status of those EPAs, you can see that on there. And there is a column for both outcome and status. Now we also have a full EPA tracking screen that's available to you. And again, this is very similar to the one that you'll see under the chart view, but it is an EPA tracking. And again, you're gonna be able to see things on there like the type, whether it is prospective or retrospective. Again, prospective is the one that we want most of those to start at. We do have the EPA type, the outcome, the status, patient name, office, and provider are available. And then of course the drug or the item that's being prescribed and the pharmacy information on there. And so you're able to track all of this and again, filter that through using your gold filter bars across the top as well. So all about tracking and information. Now, once you do input all of that information, and again, CoverMyMeds website and portal is the one that is doing all of this stuff on there. So once you get that information pushed back to you from in IMS and what those outcomes are, we want to also be able to forward that information over to our patients in a great way as well. And there's no better way to do that than the patient portal. In their patient portal, they will be able to see on there, they will have a prior authorization section under their health record area on their left tab. So same place they're able to see their prescriptions or their labs. They will have one for prior authorizations and they can actually track that on there. Again, freeing up staff members within your office from having to take those phone calls and see on there. They're able to utilize their own communications from the patient portal and see directly on there. So again, we want to make this process as smooth as possible. Okay, and so that's a very brief, quick introduction on what EPA process is. Again, it's not an in-depth process. There's not a lot of moving parts to this, and it's intentionally that way. Okay, all you're doing is you're making sure that all the information that you already would do is being done very quickly, and it's representative then on how easy this workflow is, directly from the prescription screen, directly from the MyTask screen, utilizing that same information, those same portals you're used to seeing with the CoverMyMeds website. Again, just making it easier for you to fill out. And again, getting that information in the EPA tracking screen and being able to forward that information to the patients. Again, quick, easy is workflow for your office. And at this time, I would like to open it up for any questions that you may have related to EPA and what options are available there. Oops.
Thank you, Robert, for that presentation. Looks like we have a couple questions coming in.
Yes.
Okay, first one. Is there an easier way to see what medications are tried and fail as you complete the EPA form?
Yeah, the EPA, the patient's chart view will show you which ones were declined on there. So you would be able to see if there was ones that were declined and be able to adjust those medications accordingly from the prescription screen. So I would highly recommend the utilizing the chart view and the medication screen for that. That's if you wanted to change if you wanted to change and alter medications. You can see there'll always be a history of which ones were declined on there. So you don't have to circle back and re-prescribe the same thing. Like maybe it's 6 months later and it was overlooked that it's already been declined. Then yes, you will be able to quickly see that information from the EPA tracking for that patient.
Excellent, thank you for that response. We have another question, Robert. How do formularies get assigned or used? Do we have to load them?
Very good question. You can. Formularies in the past were manually entered in, and you say that this insurance is covering these things, and that option is still available to you. But in most of today's workflow, the formularies are automatically loaded from the payers. So for the clearinghouses and the payers load those in there for you. And we do have a formulary option that is usually included in most contracts on there. If you do not have if your system still has the old manually built formularies where you go under the setup and add it on there, please contact your sales rep or your account managers or your representative accordingly, and let's get you updated to the new stuff. Because yeah, the days of entering that in manually, not ideal, but you still could if you want to.
Okay, thank you for that. Next question coming in is, if something is not covered, will there be a way to see what is covered? Kind of a follow-up to that last question.
Yeah, that was what I was going to say. That's more of a formulary versus a EPA, but the answer to your question is yes. If you have if the EPAs are coming from the payers and from the clearinghouses information, then yes, it will tell you on certain medications that, okay, Claritin is not covered. However, we recommend these items, and they will also be bracketed based off of type of coverage as well too. So some, again, are preferred more than others. So if you are providing that Claritin, but the another brand is preferred, that will the formulary will show you that information depending on the information we get from the payers as well.
Excellent. Another question coming in, Robert. Is it possible for a provider to create a task for a staff member to complete the EPA after EPA check says PA is required?
Yes, there's actually on the EPA tracking screen, they have their own, just like the referral tracking and the authorization tracking, it automatically populates onto those screens for them. So you do not need to manually task it. Again, if you wanted to manually task it, you're more than welcome to create link withs and we can create that workflow, but it would be it'd be replicating what's already being done. There's no need to do 2 notifications. They're already getting that under their if they have access to the EPA tracking screen, it's all going to do that automatically. But you could create a link with under the prescription for those ones if you want it to show up under their My Task.
Okay, thank you for that. And then kind of a follow-up to that question and same talk track. Can the tracking go to an assigned team in My Task or only one person?
If anytime you're using the My Task, great question, by the way, and this goes for anything you're using the My Task for, absolutely. You can create teams. You could create task groups that could be assigned to stuff, and you can also do it by job title as well too. Job title is really great if you have a if you're a one clinic type of thing. You can just say, hey, all my nurses take care of and MAs take care of this, and I just assign all the MAs and the nurses to do it. However, if you're multi-office, maybe it's only the nurses and MAs at the main office, so you want to be able to create customized groups that are able to do that. And yes, that is under in your reminders area in IMS. There'll be some options on the right-hand side under the setup to be able to create groups for reminder groups, and you can actually customize the name of that. Then you can call it my favorite EPA group if you want.
Great, thank you. Next question is kind of maybe a joint question if Ashley's still here. So they're wondering, can they automate the EPA, or not automate, can they use the EPA process through IMS without having to start it with Cover My Meds?
Oh, good question. No, you need a Cover My Meds profile, because that's who we're using to actually submit the data. You could turn it on in IMS, but it won't. There'll be nothing under the hood, because Cover My Meds is the one that is actually submitting and talking to the payers. So you will need a profile through Cover My Meds. Okay.
All right.
If there are any other questions, we are running short. We're just running about to the end of our time. So if there are any other questions, Brian, still make note of those, and we'll get those answered for you through communication as well.
Absolutely. Okay, next slide, please. Okay, so now are you ready to shift your practice into overdrive? If you are, please don't hesitate and please contact your IMS sales rep. or VAS reseller. And finally, I want to thank all of you for attending today's session. Please do not forget to share and follow us in our social media. And don't forget to use the hashtag UGM Virtual Summit and hashtag MeditabIMS. And when using those hashtags, important reminders to make sure that it is in public mode. So please check your settings. And finally, I'd like to also give a nice thank you to all of our sponsors, Cover My Meds, Dr. Catalyst, Global Payment Integrated, MG Hosting, and Vonage. And don't forget, we have another session coming up right after this. And thank you all for your time.
Thank you.
Thank you.
Thank you.